Hello everyone. Myself Dr. Mohammad Haseeb. I am an intensivist from OVC Group of Hospitals, Hyderabad. Today we'll have a small discussion regarding blood disorders. But before coming to the topic of blood disorders, let us think what does the blood contains. The human blood contains two main components, that is blood cells and blood plasma. The blood plasma is the component in which the blood cell flows. But what are the different type of blood cells? The different type of blood cells are RBCs, WBCs and platelets. So where are they produced and what are the functions? They are produced within the bone marrow, which are present in the long bones, like most common pelvis and in the femur. So whenever these blood cells are produced within the body, they have their own functions. The red blood cells, that is RBCs, they carry oxygenated blood from the tissue, from the heart to the different tissues for their proper functioning, and they carry the deoxygenated blood from the tissues to the lungs. The WBCs are nothing but they are the saviors. They fight against the infection whenever there is some entry of the different organism into the body. Platelets, these are the very small tiny type of cells which helps in having a blood control. That is, whenever there is an injury, they all aggregate together at that site and block it and forms a clot. So what really happens? These blood cells are all produced from a mother cell, which is called as the stem cells, which are there in the bone marrow. These stem cells in every stage of their life get divided into different type of cells and produce WBCs, RBCs and platelets. Whenever there is any defect within these process, then the blood disorders occurs. So what are the most common type of RBC disorders? That is nothing but most commonly we heard everywhere is thalassemia. What is thalassemia? What does it happen into the blood? So in thalassemia patients, normally it might be because of most common genetic defect. So what will happen? The oxygen carrying capacity of the RBCs will come down. So the low amount of oxygen is transported within the blood, so which is insufficient for the tissues to function properly. As a result of this, there may be changes within the bones, brain, heart, spleen and in the joints. The patient will become sick and needs regular blood transfusions. What is the treatment? The treatment is most common blood transfusions, and we can go with stem cell therapies. WBCs, nothing called as leukemias, which are the most commonly called as blood cancer, in which there is excessive production of the WBCs within the bone marrow immune system, which in turn leads to decreasing the platelet and bleeding manifestations. How to treat? Different type of therapies, medication and even steroids can be used. For viral type of thrombocytopenias, they usually resolve by themselves. So it is very much important that every human should have a regular blood checkups to look for any bleeding manifestations occurring within the body or any deformities getting developed, and have a regular follow-up their physicians. Thank you very much.